Right now, I'm the supervisor of the EEG department at the University of Alberta Hospital. More correctly, I guess it should be neurodiagnostics, because we do more than just EEGs. I've been here doing this role for about 15 years. And in the field, I've been in the field about 40 years. And so my typical work day right now is, because we primarily do EEGs at this site, our work day is seeing inpatients, outpatients. We not only do routine EEGs, but we've got sleep deprived studies. We see adults and pediatrics. So that really is, makes our job really diverse, because we are seeing lots of pediatric patients. We do epilepsy monitoring. So we have patients that we see, they're inpatients, they stay for several days, and we're recording their EEG, waiting to record their events. And my day, because I coordinate the team here, we not only have to sort out what services we're covering at this site, but we help to cover when there are shortages of techs at the other sites. So that's really a bulk of my day is coordinating everything to make sure that we have optimum coverage of all our services at all the sites. My journey into ENP started when I was a child, because I had had EEGs done as a child. I thought it was interesting even at the time, and pursued this. I did pursue other things in healthcare, but was quite convinced I could never put a needle in anybody. So I thought this was a perfect fit. I've since put lots of needles in lots of people, and so I got over that. But no, even having gone through EEGs myself, I was interested in it even at that stage of the game. It's nice to have seen it from the other side. There's nothing more valuable than being a patient, having had procedures done, and to see it from the other side when you then down the road are giving that care to people, knowing what it's like to receive it. So yeah, that was really valuable, actually. In the land of ENP, because we are quite diverse, there's EEG, intraoperative monitoring, evoked potentials. There's many different ways to be trained coming into this field. I did my training so long ago that there was an in-house training program at the University of Alberta Hospital, and that's what I went through. The way most people come into this field right now is they go through a college or a technical institute. In Western Canada, BCIT has an amazing program, and they've got amazing instructors. And so that's in Western Canada a really common route. In the East, there's a couple of French colleges that have a neurodiagnostic program, and we have technologists here in this department that have come from those programs, and they're fabulous technologists. So that's really the road that there are in-house training programs still in the country, but most people go through one of those types of colleges or technical institutes. For me, an awesome milestone is having been in this field for so long and then gaining the recognition from my coworkers, the physicians, the technologists, just for the expertise and experience that comes after that many years of being in one field. So that in and of itself is just a nice milestone. Being here for that long, that's been the biggest thing for me, is just the respect that you gain by being here for that long. We are a field where very little has changed over time. Having said that, certainly digitalization of everything that we do has changed things dramatically. I come from a world where it was paper graphs and pens writing with ink, to everything being digital now, that offers so many more opportunities to look at the information in a better way. You can reformat things and so on. So that part of it has been really exciting. The work we do with surgically implanted electrodes, our depth electrodes, our grids, things like that, other ways of investigating people with epilepsy. The advances in that type of recording and that type of work, where it used to be quite exceptional to have that type of investigation done. Now it's done quite routinely. And so that's been exciting to see so much more. We can offer so many more opportunities for people with epilepsy than we were able to in the past. So that's some of the most exciting. There are other areas that there's been lots of change. Intraoperative monitoring. The advancement in intraoperative monitoring has been incredible. And so now the procedures that can be monitored in the OR using electrodiagnostics has expanded so much, the type of recording that they do. And so that offers the patient the opportunity to have procedures done that maybe are riskier, but you're taking more precautions to ensure that no, simply put, no damage is being done whilst they're doing the surgery. So watching those things expand and grow has been rewarding as well. There are some things that are evolving more in the medical management of patients with epilepsy, but that's not our field. That's how our patients are taken care of by the physicians. But the field itself, other than in the land of the field of intraoperative monitoring, I think there's lots of advancements happening with that. But that is a very small part of what we do. And there aren't not a majority of ENPs do intraoperative monitoring. So in EEG, it's really some of the medical management of patients that we're seeing lots of changes. The one thing that is changing is with surgically implanted electrodes, our surgical evaluations of patients with epilepsy. That's not intraoperative monitoring. There are some advancements in the types of surgeries that are available, less invasive surgeries. So I'm really interested to know moving forward if there will be investigations we can do with stereotactically guided electrodes, if there will be more and perhaps better ways of guiding those electrodes so that you can be more discreet about finding the abnormal focus in a particular patient. So any of the work that's done with these surgically implanted electrodes is exciting, because with people that previously their lives have been ruined because they can't move forward when they're having seizures uncontrollably, maybe it'll offer more opportunities surgically for more patients so that they can lead a normal life. So that's exciting, what they're doing with the stereotactically implanted electrodes. So yeah, hopefully that'll move forward and there'll be more and more of that. This could almost apply to any career, but you know, when I'm mentoring, teaching, it's just strive for excellence. You know what, in anything you do in life, strive for excellence, because if you strive for excellence, that rewards you professionally, it rewards you personally, you command respect from your coworkers, your patients. It's a very rewarding thing to strive for excellence and to know that you're doing good work and giving the best care to your patients. Self-regulation is something that it's a lot of work when you first embark on it. And I think a lot of people sometimes say, why on earth are we going through all of this extra work when you're self-regulated? But at the end of the day, what I was just speaking to, it helps to promote that excellence within yourself, your profession. It holds people accountable. You hold yourself accountable, and you're just doing the best work that you can, and therefore giving not only the best care to your patients, but ensuring you're doing it in a way that helps to ensure their safety in every situation, right? And safety doesn't even just mean from a point of view of with the equipment being safe electrically, etc. But safety in the sense of if you're not recording this information properly, perhaps choices aren't being made for that person that will help to benefit them in their life going forward. If you're not getting the right information on the EEG, perhaps you're not going to get the best seizure control in that particular person. So from that perspective, self-regulation, you hold yourself accountable to a higher standard, you are ensuring that you're doing your continuing competency, your education, staying current with everything. So it's a win-win all the way around. We do promote safety. I mean, very simply put, we have all the patient checks in place and so on and so forth. But it's really just ensuring that you maintain the highest standards with your infection control and prevention, all your electrical testing, because we have a lot of that. We have electrodes, we have cabling. So much of what we do is reliant on ensuring that we have optimal contacts and that the equipment is working well. So it's really very technical. We feel like electricians sometimes because you do have to ensure that all of that, and we do test everything on every patient. We're lucky because we do have a process where even our little electrodes that are placed on patient, every electrode is tested before use on every patient. That's just part of our process. So that's how we ensure patient safety from a medical standpoint and an electrical standpoint. Oh, you know what? I incorporate it all the time. We do studies on little kids all the time, and they come in. I ask them how old they are. They look really scared. They're holding their bunny or whatever it is they're holding. And then I relay the story, telling them that I had this when I was a little kid. And then I even share, I say, and when I was 6 years old, and you know what? They wouldn't let my mom come in. And so, I mean, I'm 1,000 years old. They didn't let parents come in back in the day. And so I tell them that story, and suddenly they just feel more comfortable, and they realize that, oh, I was going through the same thing when I was the same age. And it really helps. I bring that to the table every single time. Other experiences, if people are afraid or whatever, I've had other situations where I'll relay personal situations to them in a vague way, you know, and giving that personal touch when you're interacting with people really makes a huge difference. If you can connect with people, and that's why people go into healthcare, right? It's because that's what you embrace, is you want to connect with people, make the experience as, I won't say enjoyable, less traumatic, if you can. And if it can be enjoyable, great. If you can make an experience and enjoyable, if people leave laughing from our lab, family members of little kids or whatever, it's a good day. If people leave laughing, that's always a bonus. My mantra in life is love what you do, and whatever you do, be good at it. And you know, in life, if you follow those guidelines, you'll probably enjoy your career. And I've enjoyed my career. I loved it from the minute I got into it, because I would bore people by telling them how exciting everything I was doing at work was. I'm sure that I horrified and bored so many family members. But you know what? To this day, I still enjoy what I do. And I couldn't imagine going to work not enjoying what you do. So yeah, it's been a good 40 years.